morning, everyone. Can you hear me?
Yes, Dr. Tharin, we can hear you.
Okay. Right, I'm going to turn my camera off now. Right, can you move to the next slide, please? Okay, so thank you everyone for coming today. And if you have any question during this presentation, feel free to ask me towards the end. And a quick introduction here about my background. As stated earlier, I'm a family medicine doctor by background and worked for about 10 years in Thailand, and I'm now working in Scotland as a lecturer. So for those who are from Thailand, there's a bit of information for you here that when we say UK, we mean that we have 4 nations here under the term UK. So they are England, Scotland, Northern Ireland, and Wales. It is important to address this because each of the nation will have a slightly different health board and also regulations as well. And please do not ever call someone from the UK as Angrid or England, because England is part of UK but not as a whole. So you may offend some person along the way. And this session here will be based on my experience here as a lecturer who lives and works in Scotland. Next slide, please. So in the UK, I can say that we have become increasingly more diverse in this country here. So the statistics from 2021 indicates that around 82% of the population is identified as white British in England and Wales. And people are also becoming more secular as well, meaning that the way they live, their values, customs may not be fully linked and adhere to religions per se. And also there will be those who were born here as a British person, and there will be those who came from overseas and settled down in the UK like me as well. So it means that there will be a very various type of people here with various cultures, needs, expectations around healthcare as well. And in terms of people with dementia in the UK, roughly the number of people with dementia who are white is expected to double by 2051. However, for those numbers here, the numbers from people with dementia from the BAME group is expected to increase by 7-fold. Next slide, please. So this is the from 2024. We have almost 1 million people living with dementia in the UK at the moment, and of which 3% are people with dementia from the BAME community, so around 25,000 so far, which is again hugely under-detected and under-diagnosed. And this number is increased to double by 2026, particularly from those who are from the South Asian background, so those who are from Indian or Pakistani heritage here. Next slide, please. Why is it important to address this one? Because in the UK or even worldwide as well, people from the BAME background tend to have an unequal access to care, meaning that they are less likely to engage with the health service, including dementia service as well. And they also face more delay and in terms of the diagnosis and support as well. Next one, please. And there are several identified barriers and reasons for that. So for instance, people with dementia and the family from the BAME background, they may have a different stigma and lower knowledge around dementia compared to their white counterpart. So sometimes dementia may be perceived as a sign of being part of old age, or it may be some kind of a God's will to test that person or test the family. There are also different expectations around caring for people with dementia as well. For example, so for those who are from Thailand, like myself, there is some kind of cultural expectations where the children need to take care of their parents when they are ill or they have dementia and so on. whereas it may be less pronounced here in the UK. And also those who have dementia, they may revert back to their main language, which may not be English. So it means that will cause extra barriers to communicate with others as well. They also face more discrimination here, as you may have seen from the news this month here, where we had several riots and protests down in England. That's one example of that. And also in terms of the screening service and screening questions here, it does not fully customize to several subcultures here. So for instance, the assessment may refer to certain specific British events here, which is appropriate to some degree, but it may not be fully applicable to everyone who lives here, for example. And also from this group here, there is less involvement and less voice of people with dementia themselves as well in anything really in terms of their ACP involvement in research and understanding around cultures as well. And healthcare professionals here in the UK, they have mandatory training around religions and cultures as well to ensure that we can deliver person-centered care that will respect the person's needs, their rights, and their wishes. But what we have so far, it is not enough because the current barriers that I just outlined earlier still exist, and there is a long and increasing need to get a better understanding of dementia care and experiences around this group as well. Next slide, please. So in terms of the culture of dementia care here, it is expected from all level actually that people with dementia is expected to live and die well in the community with support from professionals, so healthcare staff, trained carers, and they might get some support from the families. And towards the end, when they become more advanced, if they are able to, they will be moved into a long-term care facilities, so care home or nursing home. And the government can partly support the cost when that happens. So it means those who can afford to live in long-term care facilities, and there will be those who cannot afford to do that. So when that happens, again, the family have to intervene and support that person with dementia towards the end. Next slide, please. And historically, people with dementia in the UK were and are still being stigmatized by society. It is less so now, but it still does happen. So for example, when I talk with several people with dementia or even their family carers, they all say the same thing, that they have to always fight for their basic human rights to ensure that they can, just be able to express the care that they want, how they want it, and when they want. Because previously they tend to get their human rights overwritten by someone else, or people assume that they do not have capacity to express their needs, which is not true at all. And there are lots of activities and political movements lately, even more so in Scotland. So nowadays, people with dementia are more active in society now in every aspect. So they are now more involved in policy making process. They sit at the table with policy makers to discuss agendas together. They are involved as research participants. They are even involved as a researcher themselves. They author peer-reviewed articles, books altogether. So if you see the book on the right here, it is an academic book that was published last year, and it was led by my colleague Rosie Ashworth, and the author list there. Apart from Rosie, the rest are all family carers and also people who actually has dementia, ranging from the mild stage to severe stage actually. So this is a free open access. So if you are interested, you can download them later on. Next slide, please. And How can we do that here? Looking back and forth between Thailand and UK, I would say that here in the UK we have lots of infrastructure and support available here that enable people to live their life fully, no matter what the stages they are at. So, for instance, if you look at the this website here from Alzheimer's Scotland, as a layperson, you can access to any info from any stage of your journey actually. So from before the diagnosis, just after the diagnosis, how to live well, how to get in towards the end. So you kind of know what to do during each of the transition period of your life along with your family as well. So that is one of the big facilitators here in the UK to allow people to live fully in the community. Next slide, please. And these are more examples of how people with dementia and their carers have become more included with policy makings and setting research agendas as well. So the group on the left here is the National Dementia Working Group here in Scotland. And again, they are led and run by those who have dementia themselves. So they meet fairly frequently and also discuss, the agendas and priorities here, and they will feed that back to policymakers here in Scotland to ensure that what they will be drafting towards later on will be important and relevant and reflective to what people with dementia need. And that also applies to the group on the right, Caen, which is mainly the group for family carers of those who have dementia. Next slide, please. And these are the latest policies in Scotland. So one was published in 2023, and the other one was published this year, actually. So again, all of the strategies, action plans, they were all co-created and agreed with those who have dementia themselves and also their carers. And if you look at the list of contributors, you can see exactly who they are and what kind of involvement they have been involved with this policy making process throughout. Even the cover pages here, they were drawn by a person who has dementia, actually, Billy Gilder. So yeah, so this is the stage we are at right now in Scotland. Next slide, please. And that was on the macro and policy level. So in terms of the practice level, we have to support models for those who have dementia and for the healthcare staff. So for people with dementia who is in the mild and moderate stage, we will have the 5 pillar models to support them through. And for those who are around the moderate or severe clinical stage, we will have the 8 pillar model of community support here to ensure that they can receive a holistic care from the clinician team here. So at this stage, they will have a staff, and their title is called Dementia Practice Coordinator. They will be the main key person who coordinate everything for people who have advanced dementia and their family to ensure that they have an integrated care. At least that's what the paper said here. And I will go through this later on. Next slide, please. We also use advanced care planning a lot. It is one of the national agendas and priorities as well in Scotland. And in Scotland, we just changed the name to future care planning last year because the consensus from layperson is that the phrase advanced care planning is a bit confusing because they don't know what to plan in advance. So we just changed it in Scotland. So ACP is also used as a tool here to support people with dementia's preferences and wishes. And with the westernized culture here, the family will almost always respect that person's wish to the best of their ability. And there will be less conflicts in the family compared to Thailand, where sometimes the family may try to override the wishes of people with dementia. That is less so here in the UK, at least based on from my experience here and also from my research. And ACP is also legally binding in England and Wales. It is not legally binding in Scotland. Staff here will also consider the discussion that has been done to ensure that we can deliver the most appropriate care for people with dementia to fit their best interest. Next slide, please. So based on this, say, comprehensive infrastructure and policies and support, so should people with dementia here in Scotland have the best care in the world? There is, at least that's what the government claims, but that is not the case actually. And I'm going to show you why in the next slide. So next one, please. So this will link back to my PhD, where I focus on this topic of ACP for those who have dementia in Scotland. And as a part of my PhD, I interviewed 13 of them altogether. So these are various people from, those who are from the mild stage to severe stage of dementia. And the upcoming video here will be a collective voice of those who have dementia here in Scotland, and they all more or less say the same thing, that they express their concerns and frustrations of their daily life, how restrictive their life were in the past, and also lots of stigma around dementia from the public, from their peers and circles of friends as well, and also the support or the lack of it from healthcare professionals here. So it mainly depends on where they live really. So they can have a very wonderful support from healthcare staff or not so good support from the healthcare staff as well. And they also see towards the end of their journey that being moved into a care home is more of one of the biggest transition points of their life as well, because it will also equate to their loss of independence, loss of agency, change personhood as well, and also the ongoing negative perception around care home does not help either. So next slide, please. Okay, so if you can click on this video here and just open the subtitle.
I have been diagnosed dementia with a moderate degree of let me get this right, moderate generalized cortical atrophy, and I have a superpower. At first, I was misdiagnosed with something else. I was still working and became depressed. And as a result of that, I was hospitalized for half a year. Eventually, I was diagnosed. I gave up work instantly. Feel free to do what I want, when I want, no more clocking in. And then I came back to play golf with my mates. And after we played golf, people came up and say, well, I've not seen you for ages. How do you do? And I say, just been diagnosed with dementia. And that's when I found out what the superpower was. Because as soon as I said that, everyone stopped talking to me. They talk about me, over me, around me, but they never spoke to me. So that's my superpower. The ability to become invisible in a room full of people. Every day you can feel parts of it going. We feel there's something missing out there, and you feel you want to go looking for it. It's a terrible air that becomes overpowering, and that's why people go missing in that, because they go looking for something. And then I realize something we are looking for is yourself. It's the you that's been missing out. I yearn and I miss for what I used to be, you know. My sense of humor has kind of vanished. Not absolutely and completely, but to a very large degree. I'm not the bubbly, lively person I once was. Aspects of my personality changed in ways I don't like. Then I lost my job and they took your driving license away. That was like taking away your independence. I became dependent on my wife. The nurses are also not helping. Once you get diagnosed, you got hung out to dry, neither heard nor seen. I don't think they're bothered after you've got dementia. In fact, you probably get to 70. No, great. Thank you. Then I met some of the groups that do some work with older people with dementia. Like a few of them have passed away, you know, they are dead, and put everything in place. And that's when it made me realize it's, you know, this could happen anytime. You never know your minutes, so you need to get it in place now, because it's going to save a lot of heartaches and confusion and stuff. We put things, power of attorney and health plans in place, and you know what's important to us. My wife and I, we've planned our lives now down to the last detail. It's no good leaving it and not speaking about it because it's difficult. Because it's difficult, you have to speak about it. But they give you that much paperwork, and none of it made sense. You know, health plan, do not resuscitate and things. Since I struggled to connect the words, I mean, I can't even do figures. They make no sense to me. I just don't recognize it. My writing's also not as good as it used to be. What I do is just, what's the word of it? Instead of writing capital letters, it became scribbles, just rubbish. But at least I plan for the future. Whether we'll be able to do it, I don't know. Eventually I'll need to be in a home, but you know, that's also my biggest fear. Getting put in the home and nobody's coming to visit me, because I've seen it so often as well, and that probably doesn't help. And how are they going to be with me in 6 months or a year? Or, you know, will they talk to me? Is it for, like, you know, stupid or you know, that kind of way? I just don't, I don't know. Will I recognize them? I just don't know.
Okay, thank you.
I
Next
have been
slide, please. Right. So that video was a collective experiences and perspective of those who have dementia as a part of my study. And from the video there, you can see that they all, you know, express their constant fear of their loss of personhood. That as indicated from the video, that there's been the you that have been missing out there, and they try to look for that. So that also equates to how people with dementia see themselves, you know, and also how others perceive them as well, as in, who am I to, what is this person, and what am I to my family and friends and to society as well. There's also an ongoing fear of the loss of their agency and autonomy throughout as well, especially towards the end when they had to move into a care home during the advanced stage of dementia. And even though they have ACP in place, they also express their uncertainty around the future as well, that will their plans will be adhered to, what if that doesn't happen, and so on. So there's a lot to unpack here, actually, and so I guess next slide, please. So in summary, based on my experiences in 2 countries here, I see that the culture of dementia care in the UK is quite different from Thailand or even other Asian countries as well, due to the increasingly diverse populations here that we have, and cultures and subcultures as well. And in the UK here, we also have a lot of infrastructure support to ensure that that person can stay true to what they want and what they wish, even towards the end. And the approach to dementia care and healthcare in general is also more secular and focuses on person-centered care, and does not fully linked to any religions per se. And also in terms of cultures around decision making and so on, so people mainly from the white background, they tend to respect people with dementia's autonomy and wishes. But again, that is less applicable to those who are from the BAME background, say from the people from Thai background or Chinese background and so on. So to that end, there's a strong increasing drive throughout for more understanding and a more equitable care for those who are from the BAME background here in the UK and beyond as well. And that concludes my presentation. Next slide, please. Okay, and any question, just let me know.